Hello, I'm Bob Challoner, the President and CEO of Southampton Hospital, and I'd like to welcome you to another edition of Focus on Southampton Hospital, your monthly program about the events and going-ons at your community hospital. Today, with the approach of the winter season, everybody's favorite time of year here in the Hamptons, we also look forward to flu season. And we have an opportunity today to speak with our Director of Infection Prevention at the hospital, Ms. Debbie Maile, who is a nurse and also trained in infection protection and prevention. I'd like to welcome Debbie to the program.
Thank
welcome,
you.
Debbie. First of all, I'd like to tell me a little bit about yourself, your background and credentials, and then I'd like to hear, how'd you get interested in infection prevention?
Well, I started in the healthcare field actually as a private care aide, taking care of someone's family member,
Right.
and went from there to my LPN.
Okay.
Started working at Stony Brook Hospital and was amazed at the nurse practitioners in the HIV clinic.
Okay.
And they encouraged me to go ahead for my RN.
Right.
When I went for RN, I went then to another facility and did 7 years in cardiac.
7 years of
7
cardiac
years
care. Okay.
cardiac care and loved it. And it was at that time that the infection control nurse there was leaving, and it was just a good time for me to make a change.
Right.
So
And what was interesting to you about infection control?
almost everything. I started out in Stony Brook. I did a lot of the clinics. I worked a lot with immunology and allergy, a lot with the AIDS clinics over there. So I had quite a bit of a background in infection control.
And I know you've had to get some additional certifications
I did.
and things also.
Board certified in infection control,
Right.
and then went on to get my certification for central sterile technician, so that when they ask you a question,
Right.
you know how to answer them.
How to keep things,
Yeah.
absolutely. And it's certainly a very major topic in hospitals these days. For the last decade or so, we've had a campaign to reduce hospital-acquired infections. And unfortunately, people do periodically get infections in hospitals. There's many people coming in with infections, and we want to make sure that they're not spread. And people can get sick and even die if we're not careful.
Absolutely.
So it's something we take extremely seriously. I know here at Southampton, and you do a very, very careful job of
Thank you.
watching all of us and making sure we adhere to policies and procedures.
It
and,
has really exploded, this field, in the past 10 years.
That's right. You've been here at the hospital how many years?
2.5 years already.
2.5 years,
Yeah.
wow. Well, you're
Yeah,
doing a
8
great-
years in infection control, so I've seen a lot of changes.
Great, and I know we won't be talking about that today, but you've also become one of the voices of our tick center as
Yes.
well, taking questions on the infection spread by tick-borne diseases when people call
Another
frequently.
very interesting field, much bigger than it was 10 years ago. I mean, at one time we talked about Lyme disease, now we have anaplasmosis, babesiosis, ehrlichiosis, Powassan disease, so that itself has exploded.
Exactly right. And I thank you for all the great work you're doing on that as well. Well, today we're talking about everybody's favorite topic, the flu, and how it spread, how to prevent it, and that dreaded flu vaccine that we all are encouraged to get every year. We want to talk about it. And I think, first of all, one of the things we'd like to discuss is we grow up hearing about the flu. It's something that's fairly common, and unfortunately, I think we underestimate how serious a disease it is. It's, oh, he's got the flu, or yeah, we might get the flu this season. It is a pretty serious illness. But first of all, let's talk about what is influenza, first of all.
Well, influenza is a respiratory-borne disease, and so it's not your normal stomach virus. It's actually an upper respiratory. What we're mainly concerned with is someone getting from influenza pneumonia.
Okay.
And that's one of the biggest culprits for those age 65 and older.
So it isn't actually the flu virus itself, it's the other things that it's doing to the body that really...
It's usually what is the secondary from the flu virus.
Right.
Yeah.
And there's multiple strains of flu virus, I understand.
There is.
Also,
We had a
right?
great H1N1 a few years ago we were concerned about. When we see the flu virus, there's different types and genotypes. H1N1 hit a certain age group that we weren't expecting. So normally when we talk about a normal everyday flu, we're looking at children under 10, under 12, and then seniors over 65 and older. And then that in-between group, they get sick, but we don't see a lot of people die at that
Right.
age group. With H1N1, we saw a lot of people in between passing on. So we were a little concerned that it changed a little bit, and we were worried that those people weren't really prepared. We weren't prepared for that.
Right.
So that's the problem that we have with the flu vaccine every year. What strain or type are we hitting with the vaccine that we're using?
Okay. And when is flu season exactly in the United States?
It starts October and it ends in April. We wait in New York State until we have a certain percentage of counties that are seeing increased flu activities within the hospitals. And that's when they'll say flu season has now started in New York State. So it's a percentage of the whole state that have been reporting flu. Last year we started in November. One year we started in December. It usually goes to April. We went to May last year.
Right.
So it can be a longer season because we start with flu A and then we get a small bout of flu Bs.
Oh, it isn't necessarily one flu?
No,
Okay.
it's two different strains.
Okay, that are spreading. And I know that we see reports out of the Department of Health. It's the Commissioner of Health for the state
Yes.
that declares flu season
Yes.
officially started. So, but I do know that there are even cases in the summer. We see a few cases in
We
the
do
summer.
see occasionally, because you have to remember on the other side of the world, the other continents, that's their
Right.
flu season.
Okay.
So with the idea of travel, we can see some flus coming over.
Okay,
And we do get a little concerned if we start seeing flu too early
right.
or too much of a certain type of flu.
Why the winter months?
Probably just the weather, it's just the season that we get it,
Okay,
more so than anything else. We're usually in the summer, we're out, we're open,
right.
people are busy doing things. The winter, we're closed up more,
Confined in closed
confined,
spaces with people.
a lot of people together.
Right, exactly. And early signs and symptoms. I mean, I always wonder, am I getting a cold or is it the flu? What are the early signs and symptoms of the flu?
The earliest, probably you just don't feel well.
Right.
You can start running fevers, you can get chills, you can get a sore throat, you can get a little cough. Then people will tell you that the body aches are the worst. You know, they'll start not feeling good and then the body aches and the myalgias just slam you.
Myalgia is
Just very bad pain all over.
okay.
Like you don't even want to move anymore.
That achy, cruddy feeling.
right,
that you
like,
get.
but worse than anything you've ever had. Because when people say to me, well, you know, I've never had the flu, and I usually say to them, if you get it, you will never forget it.
Okay.
And you will get that flu vaccine the next year.
I know one year I did get the flu and I haven't forgotten it, and I
Yeah.
think I've gotten the vaccine every year since.
Same
right?
here, ever since.
All right. So how does the flu spread in the population, general population?
It's going to be respiratory because it's a respiratory virus. It's coughing, sneezing, people talking to you that have a lot of phlegm maybe and
Okay.
they're spewing out. You remember a sneeze travels 200 miles an hour, so if someone sneezes and they
How
don't
many
cover
miles an hour?
200.
200. Wow.
Yes.
I had no idea.
Yeah, so I do this.
Yeah,
Okay.
exactly.
So, you know, we teach the kids to sneeze into their
Right.
arms.
Yeah, this is no longer acceptable,
No,
right?
because then when you go to shake someone's hand.
Oh, good advice.
Yeah.
Okay.
So it's not always just respiratory. If someone sneezes in their hands or coughing or touching themselves and then touches, say, the doorknob,
Okay.
all right, or the sink, to turn the sink on and off, and then you don't wash your hands.
Okay.
You can also get the flu that way.
Pretty easy to spread compared to some diseases? or-
Yeah, anything that's respiratory is very
Okay.
easy to spread.
It is, okay.
Yeah, because of how quickly it dissipates.
And what's the period of contagiousness? When is somebody contagious with the flu?
Interestingly, you're contagious one day before you realize you're sick.
Oh, really?
So you don't even know you're sick and you're out visiting with people.
Okay.
And then the next day you come down with the flu.
All right.
You've already contaminated probably everyone that you visited,
Okay.
which is a big reason why we ask healthcare workers to get vaccinated.
All right.
Because you just don't know when you're going to get sick. And if you're in working on a 12-hour shift, how many people are you coming in contact with before you realize?
Feeling perfectly fine. and
Right, you
meanwhile
feel
you're
great.
spreading-
You get home that night and you're down and out with the flu.
Right.
And then you start shedding the virus.
Okay.
You shed for 5 to 7 days after you first get sick.
Okay.
So that's why when someone comes in the hospital, we isolate them. And you have to wear a mask to go in and take care of them because they'll be shedding this virus.
I see. And once you start feeling better, are you essentially no longer contagious?
Once the
or-
5 to 7 days are gone, or if you take like Tamiflu,
Okay.
which is an antiviral medicine,
Okay.
it helps you get better quicker,
Okay.
but you still can shed for a few more days.
And let's talk about the seriousness of it. And I've learned, being in hospitals, that people underestimate the flu. How serious a disease is it really?
We don't keep track of adult deaths on the flu because it's usually a secondary thing that kills you. So we
Okay.
don't really know if you had the flu, did we test you for the flu, but we do keep track of children dying.
Right.
And last year, over 20,000, in the past few years, over 20,000 children under 5 years old have died from the flu.
20,000.
20,000.
Wow.
So it's very scary to think that a child under 5 is going to die from something that we think is the flu, a simple illness. It's
Right.
not.
Okay.
It can have devastating effects. For
And-
our seniors, it's usually pneumonia.
Right.
And for children, it's a difficulty breathing and an oxygenation problem.
Okay.
So again, it's respiratory.
Any numbers on seniors that are potential?
They don't keep track of it
Okay.
because we don't, it can cause so many things. If
Right.
you're asthmatic and you get it, your asthma could kick in worse.
Okay.
If you have a cardiac problem and you get the flu, that could make it worse. So
Okay.
they don't really have a specific number. We don't report adult deaths.
And we see deaths locally as a result of it as well. It's not
We-
just some other area of the country.
We have.
right?
I have actually seen someone in the hospital get the flu and die from the flu.
You have. Wow.
So they were there long enough to know that they didn't come in with it.
Right.
So either a visitor brought it in, or it was before we had mandated flu vaccines.
Right.
Could have been a healthcare worker. One would hope not, but again, you don't know you're getting it till the day you get the
Right.
flu.
And another concern I know for us in hospitals is that people who are immunocompromised, they may be taking medications for another illness, or they may be HIV positive, and their immune system isn't working as well as
And
it
that's
should
why we
be.
want them to get vaccinated.
Right,
We want
okay.
them to make sure that they get the vaccine themselves,
Right.
and then healthcare workers get it so that we're not sharing it. We want
Okay.
pregnant women to get it. We want anyone with an immune problem to get it, asthma, anything like that.
I'm going out to visit my new grandchild in a month, and my daughter told me I'm not allowed to visit until I get the flu
The flu
shot.
shot
so-
and pertussis.
Which I did get.
Did you
Okay.
get pertussis?
I have had pertussis
Okay,
as well.
so
Absolutely right.
Those are the two things that we want to mandate.
Commonly known as whooping cough,
Yes.
right? Okay,
Yes,
great.
and there's so many young families that don't think that we need it, but we still see it here.
Okay.
So
Stomach flu, is it really a flu?
it's not a flu. It's a virus, but it's not the flu.
Okay.
It's a little different. It's more vomiting, diarrhea, which not really, we don't really see that with influenza.
Okay.
Some people will have some diarrhea. If you get the antivirals, they give you a little diarrhea, so some people don't like to take them for that reason, but
Right.
we don't normally see diarrhea and vomiting with the flu.
We don't, okay.
No.
I always assumed that was part of it,
It's
actually.
not.
Yeah.
It's not typically. It can happen,
Right.
especially with little children. So we
Right.
want to watch them, make sure they're taking in plenty of fluids when they get the flu. But typically, that's a stomach issue. It's a
Right.
stomach virus.
So how do you know you really have the flu?
You're going to get tested.
Okay.
That's about
And
the only
there
way.
are tests that would
We'll do a
definitively-
nasal swab, or the doctor will send you for a nasal swab, and we'll come back. It's good for us to know if you have flu A, flu B, so we can kind of keep track of what's going on out
Right.
there. So it's a smart idea to get tested, so you could be proof positive that you had it.
Right.
That kind of makes you not able to get it again because you've had that type of flu.
Okay.
All right. Although there are times when there's different genotypes of flu traveling around, and you can get flu A, and then 4 months later you can get flu B.
So that explains something. I know that, I had the flu once and thought, okay, I'm immune,
Right.
like measles. You get it once and you're probably
Maybe
immune.
once that year you could be
Right.
immune to that genotype or that strain,
Right.
but the following year, the flu virus, they call it a drift or a shift. It just
Okay.
changes enough so that it reacts differently.
Okay.
So last year our flu vaccine wasn't that good because it drifted a little bit, and we were a
Right.
little bit off on the vaccine, and so a lot of people got the vaccine and still got sick. So this year CDC has an advisory panel, and what they do is they keep testing to the end of the season, and they try and make up the flu vaccine for the next season according to the most type of strain they had the previous year.
Okay. So whatever they're seeing is most common.
Right, that's what they'll do.
So there are many, many strains, I guess. So that's why.
Well, this year we're going to give the vaccine that's called a quadrivalent. It's normally we give a trivalent. Because of the shift, we went with the quadrivalent. So it'll be 2 flu A types and 2 flu B types.
Okay.
So it's H1N1 and H3N3, I think it is
Okay.
this year, and then 2 B typos. So that we can probably, most people will give a trivalent vaccine. That's 2 A's and 1 B
Right.
in the vaccine. We're going to do 2 and 2, just to see if we can cover all bases for our healthcare workers.
Okay. So we're obviously then must be seeing strains of it generally, or they're seeing early signs
Yeah,
of
we
it.
were just concerned because, it's mandatory for healthcare workers to get the flu vaccine, or they have to wear a mask while they're working.
Right.
So we wanted to make sure we give the best for our employees, the best coverage so that nobody gets sick.
Okay. And again, let's talk about that for a second again, the healthcare workers. And I know this was a rule that went into place in New York State. All hospitals in New York State now, we require that our workers, you can't come to work without the flu vaccine or wearing a mask.
Yeah.
And it's primarily for protection of our patients, right? That we don't, and the visitors, that we're not spreading,
Right.
we as healthcare workers. And I know we have a mechanism where we actually put a little sticker on their badges. This year it's
Yeah.
red. I've got mine
Yes.
already.
Oh, did you get yours?
I got mine
Okay.
already, so we're looking for the red
And
stickers.
every hospital has something like that.
Right.
A lot of them are using a sticker.
Right.
So it kind of helps when you go to other hospitals. You can
Okay.
see who's had the vaccine. But again, it's mandated for all healthcare workers in New York State
Right.
that work in acute care
In the hospital
in the
setting.
hospital.
Right.
Yep.
What about nursing homes? Do you know if
I'm
it's
pretty
mandated?
sure they're mandated too.
I would
Yeah.
think so. So the flu seems to vary. Some years you hear about a mild flu season, some years it's a very serious, and what
Again,
are the
it's-
reasons for that?
It's the strain that's floating around there.
Okay.
Is really what's happening.
Okay.
If that flu drifts a little bit, the vaccine that we created for the original genotype isn't going to work.
Right.
And so we don't capture everything we need to capture.
Okay. And Debbie, what's the difference between cold and the flu? I mean, a lot of the symptoms are really similar. You can
Yep.
get a fever and respiratory with a cold.
With a cough, you can get a sore throat. Influenza is just probably a cough 10 times worse.
Okay.
It's just a little stronger virus
Right.
than a normal everyday cold. It just hurts people more.
Right.
It can kill versus a cold is not going to kill you,
Right.
but the influenza can.
Okay. And if I've got the flu, I haven't been vaccinated or didn't get vaccinated in time, I get the flu, and suddenly my symptoms start to get a little bit worse. Are there any clear emergency,
Anytime
should
you
you
have-
go to a hospital automatically if you get the flu? I don't think so.
No,
but
we
are
would
there-
prefer you to stay home.
Right,
If you're, say, between ages 12 and 64,
right,
and you're just sick with the flu and you can stay home, you're keeping down fluids, your fever isn't too high, spend a few days in bed, drink
Right.
fluids, take your Motrin or your Tylenol or whatever works for you.
don't
If-
go to work because you'll spread
Please
it.
don't go to work.
Right, right,
It's very hard for healthcare workers to follow that creed, but it's very important that you don't come to work sick and
Right.
spread it around. If for some reason you start feeling like you can't breathe, you're having intense shortness of breath,
Okay.
you're not taking in fluids and you're dehydrating, we want you to come to the ER. Let us hydrate you up. Let's see if you need to be inpatient, or we could hydrate you and check you out, and maybe you can go back home again. You don't
Okay.
have to always be inpatient.
What about for small children under 5,
Same
6 years
thing.
old?
The minute they start looking a little blue, they're having a little difficulty breathing, they can't keep fluids down, they're either throwing up or just won't take them at all because their throats hurt.
Okay.
Bring them on in either to the pediatrician or to the ER and let us hydrate them up and take a look at them and see if they need to be admitted.
Now, if I've got the flu, and some diseases I know if I've got an infection, I can take an antibiotic, and the antibiotic will make it go away. But the flu doesn't work that
It's
way,
a virus,
right? It's
so
a
an
virus.
antibiotic won't work. We can give you the antivirals,
Right.
but again,
But they don't really cure it, right? They
no,
just-
what they do is they'll stop the flu quicker, 2 to
Okay.
3 days quicker. So
Okay.
you know how you felt with the flu.
Right.
I would have loved to have an
Yeah,
antiviral
me too. Me too.
for a few days less flu symptoms, but it's only going to give you a couple days less flu. So if you're okay with just dealing with it and getting through it, the antivirals can give you nausea and diarrhea.
Oh, they can. Okay.
Yeah. So some people don't like that worse than the flu.
Right. And you have to decide, I guess,
Which way you want to
what's
go,
worth. But
or
there
how
is-
sick you are.
There is no instant cure pill for it, unfortunately.
isn't,
You got to
no.
let it ride its course somewhat.
Yes.
So, what about chicken soup?
Always a good thing.
Okay, great. So vaccines, let's start to talk a little bit about the vaccine and the influenza vaccine. Let's just basic vaccines 101. How do vaccines work?
You give a vaccine, in this case it's not a live vaccine is what we give.
Okay.
your body starts building up antibodies towards it, so it knows when the flu comes, it knows to attack it.
Okay.
So it takes your body about 2 weeks to build up enough antibodies for the vaccine to actually work.
Right.
So that's why we want you to get it sooner rather than later.
Okay.
Like you said, so you don't get the flu in the intern. I could give you a vaccine tomorrow, and 3 days later you can come down with the flu because you didn't give it enough time
All
before
right.
you got sick. So your body builds up, makes antibodies. So if you get the flu, it knows to go against them.
So
and to
that triggers
defend
a
itself.
couple questions for me, and some of the things I often hear about vaccines and kind of misconceptions. One is I've heard people say, "Oh, I'm starting to get the flu. I better go get a vaccine." Sounds like that's probably too late.
Too
right?
late. Too
Okay.
little, too late.
All right. Unless it does turn out to just be a cold, then maybe later on.
Then
that's
it'd be okay. But if you have a full-blown cold, we would prefer not to give you a vaccine.
Not to give
your
it
body's
anyway.
already fighting something. Wait till you feel better.
Okay.
Yeah.
And essentially what you're doing is tricking the body into thinking it's already had it, right? So you've
Right.
built up the so it's the same,
So it's kind of like telling your immune system, we don't like this.
Right.
You know, so look out for this, like a wanted poster.
okay.
Yeah.
And people, I've heard it said many times, I got the flu vaccine and then I got the flu, that they
Yeah.
thought the vaccine gave them the flu. Is that possible?
It's impossible because it's not a live vaccine.
Okay.
But maybe your immune system has gone on overload.
Right,
And so you're not feeling well from that.
right,
It's hard to explain that to people because it's not a live vaccine. Now we want to talk about the nasal vaccine because there
Okay.
is a nasal spray that you can use.
right.
We don't have it here at the hospital. It's only for certain people, certain age groups.
Right.
It's for no one that has immune deficiency. You shouldn't have it if you have asthma. You shouldn't have it if you're pregnant. It's a live, attenuated vaccine.
Oh, really?
Right.
Okay.
So now you're giving your body.
Attenuated means it's,
It's in a
moderated, or
yeah,
the effect
it's in a
of it's not
substance.
as strong,
So
right?
some people can have it because it's a lot easier to give, a little nasal spray. But you wouldn't want to go around near anybody that has an immune problem because now it's a
Okay.
live virus in
Okay.
you. Okay, and you could spread it that way. So it's a very small window of people that should really have that.
Okay. So generally, it's the needle, unfortunately.
It's
so,
the needle is the best for everybody.
yeah.
So we would never give a healthcare worker a live attenuated vaccine because they're going to be around sick people.
Okay.
So that's why we all get the needle.
We all get the shot. And this notion of I got the flu right after I got the vaccine, could be you were getting it anyway, you just didn't get the shot in time, probably?
It could be, and it would be nice to know if you got tested
Okay.
to see if you really had the flu. So
Right.
if you think you got the vaccine and then you got the flu, it would be good for you to go get tested.
Right.
Just to make sure.
And I guess as we saw last year, there are some, because there are multiple strains, the vaccine wasn't, the vaccine didn't cause it, but it wasn't that effective in
Right.
preventing all the
Right.
strains,
What
right?
happened was it was H1N1 and I think H3N3, H3N7, and
Okay.
there was a different strain out there, so it covered for partial of the
Right.
strains, but not all of it. So
I heard the number
just-
was somewhere around 50% or something like that.
it was a
yeah.
terrible match.
Yeah,
And
okay. I
It's
guess-
not good to be in this seat when the vaccine doesn't work.
Right, exactly, exactly. So that, I guess 50% is better than nothing. then,
I would
so,
I would
yeah.
like to be covered for influenza B and one influenza A rather than none.
Right, I agree, I agree. And if I got the vaccine last year, well, last year was a bad year, but I get it every year. So why do I need to keep getting it every year?
Because the
Right.
strain is different
Okay.
and it wears off actually. Is
It
what
does
happens.
wear off,
Yeah.
okay.
Your immunity to the flu, as time goes on,
Right.
you need to be revaccinated.
Not like most of the childhood vaccines.
Right, those
that-
are a little bit different. I
Okay.
guess they're made a little bit different.
Right.
So those, we build up immunity forever.
Right.
But for the flu, every year you need to get a new vaccine.
So who's predicting what the virus is and which ones are going to be out there?
CDC does that.
Okay.
CDC, what happens is
CDC, Center for Disease,
disease
Control?
control.
Okay.
Yes. Even on the level at acute hospital, myself, I monitor how many patients we have inpatient, how many patients we've admitted, the age group that we have admitted, and I send a weekly report
You do?
once flu season starts.
So they're collecting data
They're
all
collecting
over the
data
country.
from all over the country,
Right.
and then at the end of the season, they'll put it together and they sit with an advisory group and they decide. Occasionally, what will happen is someone will send a sample off to CDC and they'll keep it in their data bank so they can see what strain is out there and where, so they
Okay.
know what's happening. And they collect the data and they'll put it all together and they sit together and decide what we're going to be using for vaccines the next year.
And are they monitoring internationally too? Because I would think they'd be able to, does it start earlier in some parts of the world than here?
Like I said, it's the different cycles. Right now we're going into winter and I think Australia's going into summer.
Okay.
So they would have had their flu season already.
Other vaccines or other types of vaccination, there's the nasal spray, which you explained very well as a, should be used probably in very limited circumstances, and certainly not for healthcare workers. Other than the shot, is there no pill format or anything like that?
There's
I've
no
had a
pill.
couple people say to me, "Can I take a pill to be vaccinated?"
Not yet.
Okay.
Not yet.
What about the old wisdom of, you remember when we were kids anyway, one kid would get the chicken pox and mom would put all the kids together. Not a good idea with the flu, probably,
because
right?
you know, it's such a horrible virus
Right,
that you can actually die from it.
right,
So not many of us died from chickenpox,
Right.
although I'm sure some did.
right.
I'm sure that there is some out there, but we don't really want to bring other people into this.
And also, chicken pox, you get it once and you do develop
Right,
almost
your
a
immunity
lifetime
for
immunity
lifetime,
for
yeah.
it. Right, exactly.
So this is not the same as that.
Yeah, you're
Yeah.
maybe immune that year after you've suffered through the full-blown disease.
You
so.
could, yeah, you could be immune to that strain that year, but again, the following year, if that antigen drifted or shifted in any way, you're not going to be immune again, so you need to get another vaccine to stay on
Okay.
top of it. You can get different flu vaccines with different kind of preservatives in them.
Right,
Some of them have something called thimerosal, which we don't give to pregnant people. So different companies put different preservatives in it.
okay.
So that's kind of what the different acute care areas will decide who they want to buy it from, who has a stock that we could use.
Sounds a little scary in this day of organic foods and things, the idea of preservative. What is that about? What are the preservatives? What are
The one that
purpose
most
of it?
people are concerned about with pregnant women is thimerosal.
Okay.
It's like a metallic,
Okay,
yeah,
so they're,
preservative. Trying to
Okay.
think of it, mercury. So it's a mercury preservative.
okay,
So that we don't want to give that to pregnant women.
Okay.
So we try and pick companies that we don't have to use that.
right,
All right. So there is some changes out there. One of the things that most people say to me is, you know, it's grown in eggs. Yes, that's how they grow it.
right.
So if you have an egg allergy,
Yeah, I was going to ask that. That's one of the
Yeah.
questions I'll ask. Do you have an egg allergy? So.
if you have an egg allergy, you can have, well, I eat eggs and I get a stomach ache. Well, that's not really an egg allergy.
Right.
You don't do well with eggs.
Right,
If you said to me, I eat eggs and, you know, I get a little itchy, I'd be questionable about whether you should get the flu vaccine right
Right.
now. But if you have a total anaphylactic reaction to eggs, you cannot get the flu vaccine
right.
at all. All right. Or if you've had Guillain-Barré, which is
What is that? I've heard that. That's one of the questions I've seen asked on the questionnaire.
it's
too.
a muscle disorder.
Okay,
All right. So you can get it from the flu vaccine. It's probably due from one of the preservatives. We don't really know
Right.
why it switches that on for some people. It's a paralytic disease, so you start getting paralyzed.
okay,
All right. Most people get better from it, but
Right.
it takes a very long time to get over that.
right.
It's not a week or two, it's weeks. So if you've ever had that, we would not give you the influenza vaccine.
So eggs or Guillain-Barré.
Yes.
And
Those are the
pregnant
two.
women, obviously, some
And pregnant
special
women, we
but-
want them to get the vaccine, but not with thimerosal.
Okay.
We don't want them to have the mercury that's in it.
Any age groups that should or should not get the flu vaccine?
We always want our little children to get them, the
Okay.
vaccine, and we always want our seniors over 65 to get
Okay.
the vaccine. As infection control, I want everyone to get it
Right.
because the more people that get the vaccine, the less it's spread in our community.
Right.
So we call it herd immunity.
Right,
So some people say to me, well, you all get it, then I don't have to.
Right.
But it doesn't work that way.
no, it doesn't.
Yeah,
It
it's
doesn't.
best for all of us to get vaccinated, but those that are immune deficient, the very old and the very young, those are our focal points. So if we had, by chance, some time when we didn't have enough vaccine, then we would focus on the immune deficient, the asthmatics, the pregnant women, someone with HIV or AIDS, and our young children and our seniors.
The more high-risk folks.
More high risk. Then we would go to our healthcare workers, and
Right.
then we would go to the rest of the community.
Okay, so we have had shortages in some years. This year, how's it looking so far?
I don't know. I have not
Okay.
heard of anything bad yet, but
Okay,
supplies are just being sent.
Okay.
So we'll see.
and I know that we're starting to vaccinate now. We actually...
We just got our vaccines in, and our paperwork is all in the printer.
Right.
So we'll have all our paperwork for them to start offering the vaccine on their units next week.
And one last question. I sometimes, when I've had the vaccine, I do feel a little achy or my arm's a little sore afterwards. And is that a fairly normal reaction?
It is pretty normal. Anytime
Right.
you get an IM injection, your arm is
Okay.
not going to be that great.
Right.
Last year we had quite a bit of sore arms.
Achy
So
arm kind of
again,
thing, right.
it might have been a preservative that was in it that year.
Right.
So I do tell people put a little ice on it. You could take some Motrin or Tylenol, and if it doesn't get worse in a day or two, it should just go right away.
Okay.
Yeah. If
And
it gets a day or two longer than that, then you need to come back and let us take a look at it.
and a little bit of achiness or a little bit of almost feeling, that's your probably body...
That's probably your immune system
kicking in, right.
saying, what is this?
Right.
And starting to work.
Okay. Certainly it's mild compared to the actual
To
flu.
the flu, yes.
Absolutely right. So, well, good luck. We certainly are going to be spreading the word, and I agree with you.
Okay.
I hope everybody in the community gets the vaccine. And thank you, Debbie, for
You're
the great
welcome.
work you're doing here at our hospital, keeping us safe and infection-free. So, and to help everyone get their vaccines this year, Southampton Hospital will be offering our annual hospital adult influenza clinic. That clinic will be held on Wednesday, October 28th from 9 to 8 p.m. It is free, a little bit of paperwork as we check for some of those issues that Debbie talked about, but it is absolutely free to the public, and we would like to encourage as many people as possible. And I know we'll be offering a clinic in helping with the East Hampton Health Foundation out in East Hampton as well for our friends in East Hampton. That will be held here at Parish Memorial Hall. It is for ages 18 and up, and please bring an ID for children. We'd like you to consult with your pediatrician. I'd like to thank Debbie for being available with us today, helping us spread the word about the flu season and the flu vaccine. I'd like to thank our friends at CTV celebrating their anniversary this year, and also for all the great work that they're doing in our community, and for producing this show each month and showing it in Southampton. And for LTV in East Hampton, our friends in East Hampton, for airing our program in East Hampton. If any of you have questions, concerns, have an idea for a show, or just need help navigating our healthcare system here in the East End, please give my office a call at 631-726-8555. We'll do everything we can to help you. I hope you have a healthy month. Get your flu vaccines, and good health, everyone.